We're now live. Hopefully your colleagues join. Once they're working. I'm gonna shut the blinds. Actually, no. I'm gonna do it. If someone comes on Zoom, sure. Who do we have? Oksana. Hello, Oxy. Oksana's downstairs.
The dentist clinic?
Yeah. So, come up whenever, Oxy. Oh, nice. We got some people coming in. So, oh, Tracy. How's it going, Tracy? Thanks for being patient with me. So, we're going to get started in a sec. We have a special guest today. Well, not even a guest. A new addition to the family, to the Pursuit family. It's Brooke. She'll be joining us as a physio. Hopefully forever.
It's the plan.
Welcome, Brooke. How are you doing today?
I'm good. How
I'll
are
put you on the spot. I'm okay.
Sunny's
I'm
enjoying
okay.
the rainy weather.
It reminds me of Vancouver. I was saying, I don't know how to explain it. It sounds weird. But I like when the windshield wipers wipe away the water. It's very soothing. Like, I'm the type of person that could watch someone get a haircut for like hours. Like, I like those videos where it shows like
satisfaction.
Yeah, those I can. I won't say how long I watch those for sometimes, but it's okay. I have no shame. I'm telling more people. Oh.
And just pull down.
There we go. Okay, good. So we're gonna get started in a few minutes. We'll give it a bit. These days, not as many people attend, and it's not because we're not cool. It's just I think people are back to work. You saw like this huge dip, but I do post this, or we do post this to the story. That way people can watch it after. And then the same amount of people watch it. Oh,
hey pal!
Look at this. Who's this?
Hey,
Why
Chris.
are you here? Why is Brooke is your name? So, we're the best team ever, better than everyone else. So,
Broad statement, but
what? This is true. It's nice to have someone else here. Usually it's just like me alone.
Sunny talking to himself.
Nothing against Robert Brandon, but like, actually no, it's still fun. But it's nice to have like new people, humans. I miss. She says, "Go Brooke."
My own cheer squad.
I miss humans. Well, actually, now it's fine. Now it's a different kind of contact with the mask. Well, how was your entry to your career wearing a mask?
It's definitely different. Not used to ever wearing a mask before, so now having to put one on. But I think it's not too bad. Get used to it. A little hot, but.
What are you most excited about for being a physio?
Working with patients.
Okay.
Getting to put some of the stuff we learned in school and on placements, and helping people get back to doing the things they like doing and meeting new people.
That's important. I'd agree with all the above. I think that's why I do it. Yeah. Probably.
Getting to rack Sunny's brain every day with questions.
I've been actually no. You haven't. It's only been a couple of days.
Yeah.
I like
Just
answering. When it comes to questions, like I like answering them. Like even previously, I think I was a bit of a mentor to some physios, like reports and stuff, how to do like certain things. That's pretty straightforward. I like the challenging questions. Sometimes I don't know the answer, and as I talk about it, I figure it out. Okay, it's crazy. And then also, I'm having a poll. Who thinks I should get a clinic dog?
One vote yes here.
One vote yes. That's where I'm at. Who would like me? Oh, Silly Ann would want me to get a dog. She has a very cute doggy. 2 cute doggies. Shane as well. Well, Shane doesn't have a dog. Yes, Silly Ann just said yes right away.
See?
So it looks like I'm getting a dog. Brooke, woo! Shane Glass-Smith.
Shane.
Mr. Glass-Smith. You know what we should have done? We should have got your phone on your account, and then it would have alerted more people.
Next time.
That would be so much cooler. People with allergies, question marks. You know what, Shane? Log off. No, just kidding. That is fair. This is why I actually designed the clinic somewhat around the dog. So I have our private offices, Shane, like my office, finance office, and it separates from the clinic. So there's a door that shuts. Plus there's medical grade HVAC. So
We worked through that option already.
I like to say the coronavirus can't survive here, but that's not like true. But there is good HVAC, so it's fine. But you're right. There would be a disclaimer for people with allergies. Yeah, you kept it real, but that's okay. As I'm sad now, I will move on to So this is very good. This is very exciting for me because I've been chatting with Brooke for quite some time now, and it's really special that she's here because I've been kind of like dreaming about this day. So for me, it means a lot. So thank you.
Yes.
So,
thanks for having me.
It's kind of surreal for me. Like day-to-day life doesn't get very exciting for me, like going home and eating dinner and reading. But this stuff, like the clinic, definitely gets me excited. So every day coming to a clinic keeps me.
Yeah.
And thanks to people like you.
Thanks.
Good. Okay, let's get started. Before I talk everyone's ear off too much, I'm gonna point this down and we'll get started. You know what I'll do? I'm gonna grab a block. Now that we treat patients, I kind of have to like disassemble the presentation area. So, which is just a Tidex box. Thank you, Tidex. So there, that should be better. I think. And let me just. Oh wow, it's a decent amount of people today. So there we go. So today we have epicondylitis, make it go away. If people think of better titles that I should put, let me know. So Brooke and I are gonna go through epicondylitis, what it is. There's medial lateral. We've all heard golfer's elbow and tennis elbow. So we're gonna describe the differences between those, how it happens, the common symptoms, and then just some simple treatments to try. And again, with treatment, the disclaimer is if it's like sharp shooting pain, it's not managed through anything, then go get some help first and then try these exercises. If it's like a moderate pain or you've been noticing it for a long time, then give these a shot. But get help if things aren't feeling too well. Hopefully this doesn't shut down like last time. So.
All right, so this is kind of just a quick review of the elbow, and that's kind of where we're going to be talking about when we're talking about tennis and golfer's elbow. So the elbow is kind of made up of 3 bones. So the humerus is the bone that makes up your upper arm, and then our forearm is made up of 2 bones, the radius and the ulna. Now, an important part for the talk we're going to be doing for the rest of the time is this lateral epicondyle on the part of the humerus here. This condyle is where lots of the muscles come and attach and is kind of known as the problem area with tennis and golfer's elbow. So this is just quick to show what we're talking about when we talk about kind of some of the tendons that are going to be involved. So as you can see here, the wrist and forearm is made up of lots of different muscles. So this is the flexor compartment. So this would be if your palm was kind of facing up towards the ceiling. All of these muscles kind of come and they originate on this kind of common flexor tendon, and that's where we tend to see some pain. And then if we flip over here, this would be with the palm facing the floor. Same thing, these muscles that extend our wrist have a common origin here, and that's called our common extensor tendon. So then kind of differentiating what tennis versus golfer's elbow is. So tennis elbow is also called lateral epicondylitis. So that's going to be pain on the outside of your elbow. So if your palm's facing down, that's pain kind of on the outside of your elbow. And we can see that that's kind of where that lateral epicondyle is. Whereas golfer's elbow is going to be when your palm's up and it's more on that medial side of the elbow, or called medial epicondylitis. So what exactly is epicondylitis? There's kind of lots of different ways that tennis elbow can be classified. Epicondylitis is kind of an older term, but what that really refers to is a painful tendon due to inflammation or surrounding an epicondyle. But it's not always an inflammation kind of issue that's causing pain. Some studies looked at ultrasound of people that were symptomatic, that had like presenting with a tennis or golfer's elbow, and they showed that the affected tendon could have like little micro tears, calcification, or thickening at the tendon that can also cause some of the symptoms that people come in with. So medial epicondylitis, or golfer's elbow, which could start to get relevant now that they have open golf courses and people are back out in golfing. So that's more of an overload or overuse injury as opposed to kind of like an acute injury that you would see with like a muscle strain or something. And it's usually due to that wrist flexion, so kind of bringing your wrist towards your forearm, like you get when you're kind of going through your golf swing. So there's multiple muscles, kind of like we showed earlier, that share that common origin at the medial epicondyle that attaches just to the humerus there, and that's where we tend to see some irritation. It's often quite a bit less common than lateral epicondylitis or tennis elbow, so it's not seen quite as much, but it still does present in about kind of 9 to 20% of cases. And like we said before, it's kind of that chronic repetition of both a concentric and eccentric contraction. So overall, just like repetitive loading that causes it. It's not just seen in sports players, they kind of get sports names, but we also see it in occupations like carpentry or plumbing, where people are maybe using a hammer lots or using their kind of wrists and forearms a lot. And then with sports, some of the sports we see it in is obviously golf, that's where it got its name, but also with baseball pitchers, bowling, and weightlifting as well, because you're kind of using that wrist flexion. So if you are trying to figure out if golfer's elbow or medial epicondylitis is something that you might have, some of the symptoms that patients typically present with is pain on that medial side of the forearm or elbow, and it can even radiate down into the wrist and the fingers. Usually if you kind of touch or push in that area, there's some tenderness at those flexor tendons, those muscles that are on your forearm. You can also have some stiffness and weakness of the elbow, wrist, and hand, because those muscles affect not only the elbow but also the wrist and the hand. You can see kind of stiffness at all of those. You might have some numbness and tingling in your 4th and 5th digit, which is kind of your ring finger and pinky finger. You might also have increased pain with wrist flexion and pronation, so that's kind of turning the wrist, as well as some weakened grip strength. So if we just take kind of a closer look here, you can see that all of these muscles are what make up kind of the flexor muscles of the forearm. So they help to flex the wrist as well as the fingers in through here. Oh yeah, you can't see my mouse.
That's okay. See my finger.
The reason that we often are looking, the pain represents at the elbow, but often it's due to wrist movement. All of these muscles then, as you bend your wrist up, are kind of shortening, and then you can get some irritation at that medial epicondyle. So then kind of its counterpart, or the more common one, is lateral epicondylitis, which probably more of you have heard of. That's referring to tennis elbow. So what that is it's more lateral elbow pain and forearm. And similar to medial epicondylitis, though, this is like a repetitive overuse injury. However, like I said, it's not always sports people. Only about 5% of people that have this injury, it's actually from kind of overdoing it on the tennis court. So it is very familiar with kind of just general population. Some of the times we see it is if someone's kind of using their computer lots, if they're on their keyboard or on a mouse lots, heavy lifting, or if you have kind of a forceful rotation of the forearm. Some sports that we see this one in is a little bit more of those racket sports where you have that extension of the wrist when you're going to hit a ball. So that could be squash, badminton, obviously tennis, swimming, or baseball it's also seen in. And then it's also seen in some kind of trade occupations, so electricians, carpenters, if people are out planting their gardens now, and then, like I said before, some desk jobs. And this is usually due to the extensor muscles, so that's that bending the wrist up. It's most common in people kind of 35 to 50 years old, and it affects about 1 to 3% of the population, so it is seen quite often. Now the symptoms with this, similar but a little bit different to medial epicondylitis, is you're going to have pain on the back of your arm, so that's where those extensor muscles are, and it can radiate kind of up and down, either up into your arm a little bit or down into your forearm. This one rarely radiates into the hand though, which is a little bit different than when we saw the medial epicondylitis. Flexibility and strength are affected, as well as you might notice that you're a little bit weaker when you're carrying objects. The grip strength is going to be decreased because those muscles cross the joint of the wrist and the fingers, so soreness of those is going to affect your grip strength. The good thing though is that about 89% of these people that come in with these symptoms and have either this tennis or golfer's elbow usually recover in a year without any treatment. That being said, we're going to go through some things that can make sure that you can recover quicker than within that year and that you don't have a recurring injury going. But overall, most people tend to do really well and get better. So then this is just a quick picture that's showing these muscles that make up the extensor compartment of your arm. Often the culprit with tennis elbow is this one that we call the extensor carpi radialis brevis. So that muscle comes and it crosses the wrist and it attaches kind of here to the 2nd and 3rd metacarpal. And what that's going to do is it helps to kind of stabilize the wrist. So that muscle is used a lot when you're kind of constantly bending your wrist up. So this is a muscle that we kind of just focus on with some of our treatments, but overall it's kind of that whole extensor compartment that's affected.
All right, and research-wise, the 89% fact is interesting. That's just to make people realize that it's not going to be like a debilitating condition, but you should still come in and get some help because you can expedite the process. So this study, home exercises versus on-site rehab in the management of lateral elbow tendinopathy, a critically appraised topic. This is an interesting article. Kind of goes like just doing home exercise or going to see a physio and kind of doing everything. So it looked at it, people pretty much saying that they can manage it at home and do the right exercises and kind of do the rehab that way. So on-site physical therapy to treat lateral epicondylitis are more effective than at-home exercise programs. So on-site, they had education, they had exercise, they had modalities, they had quite a few different treatment. They didn't have needles in the study, but they had a combined physio approach. So home programs are still important as it's one factor in recovery. So you should still have a home program. So that doesn't mean just go see a physio and that's all you're gonna do. You should be prescribed some home exercises. So that goes into should be a combined approach on site. So educational manual therapy modalities was used, moderate evidence. So it's still a pretty strong study. And I thought that was pretty interesting. I can always give links to people who want the full article. There's this one going through neuromuscular control. I know Yahya, a colleague and friend of mine, came in and talked about neuromuscular control and things like that, and that's kind of a big thing that's coming in the new and fun, exciting thing in physio. So this study is quite neat because it looked at neuromuscular control, more so with lateral epicondylitis. So it's an EMG study, so they studied muscle control and activation. So this examines a more central approach. So you get injured and it's more complex than just the muscle getting injured. You actually use your arm differently, and it even shows reduced strength in the shoulder girdle in this study, which is interesting. So so the rate of force development for grip strength, so squeezing something, for instance, was reduced. And also the more interesting fact was there's slower activation of finger flexor muscle. So it's not only weaker, but it's slower. So one could argue that's a protective response. One could argue that's just a learned response, but the results are it's weaker and it's slower. So that's quite interesting as well. So doing some more neuromuscular work would be a good idea. That's the implications of this study. Still needs more research, like every physio study. Implications is always more research is needed. So, but you can work these concepts into exercise programs pretty easily. We always hear about eccentric exercise for a number of different issues with tendon. This study looks at eccentric exercise as an effective treatment for lateral epicondylitis. Then it reinforces it with pretty high level evidence that eccentric strengthening, and we'll go through that in a second, should be used in treatment programs. Maybe not right away, but as you progress and get better, you should be doing eccentric. So all groups performing eccentric exercises, and I believe there's 12 studies, and all 12, actually there's 13 studies, all 12 showed big improvements. One was not a rigorous study, so it wasn't a good study, and it didn't show any difference. It didn't show any harm, but it didn't show any difference. So 12 out of 13 studies showed improvements in the group that did eccentric exercise. So that's not only just decreased pain, it's increase in function and grip strength. So that was quite interesting, and I can link you to the actual article itself. So eccentric is an important concept. We've been taught to do eccentric training over and over again. This is just more reinforcement to do it. So I can leave this one to Brooke here.
And then just some kind of quick tips before we go into some exercises and stretches that we're going to go through. But one of the main things, if you're having some of these symptoms, is going to be mainly activity modification or load management. So not stopping everything you're doing, but if you find that lifting heavy things or kind of when you are playing tennis or at your desk is really bothering you, then we need to find a way that we can kind of modify or reduce some of the repetitions of that activity so that you're not continuing to irritate that tendon, to give it some time to heal while you incorporate some of the exercises that we're going to show. And then there is stretching, which similar to all other physio studies, it's kind of up in the air. I did read one article that kind of looked at static stretching versus more of a contract and relax. So that's going to be something we can go through too, but it's going to be more so related to your pain and what works for you. So we can go through some of that. And then right now, because lots of us are working from home, you might find that your setup at home at your home desk is a little bit different than your office setup that you might have had a proper assessment for. So if you find that this is an issue that's come up, a couple tips that we can do to just make your home setup a little bit more functional so that you don't kind of develop this issue.
So that's the presentation, but now we have activity. So we're gonna go through some activity here. And I can move stuff around as need
Okay.
be. I'm used to this by now. I'm just gonna go stop sharing on Zoom, which, yeah, we can leave that. There's no one on Zoom. This is usually where we get most individuals. So yeah, we can go into exercise.
Okay.
I guess we can start with medial epicondylitis and kind of go from there.
Yeah. So like we kind of said, now that you can see us, medial epicondylitis is going to be more so pain at that medial part of your elbow, and that's going to be from that wrist flexion. So one thing that you can do is if you have like a tennis ball or a lacrosse ball, you can take that and you can kind of work that into some of those sore or tight muscles. If you find a part that's a little bit tender, just working in through there to help to release some of those muscles. And then if you're experiencing more pain or have that lateral epicondylitis and that pain's more on the outside when you extend your wrist, then you can just simply take the ball and now you're doing it on the back of your forearm there. And then for some stretches, one of the stretches that you can do, if it's quite sore, you can start with kind of elbow bent, and then you can just bring your hand down, and that's going to stretch out that flexor compartment of the arm there. If you don't really feel anything there, then straightening that elbow is going to kind of increase the stretch.
Yeah, that's good.
Now if you have pain more on the lateral side or that tennis elbow, then you're just going to flip the arm over, and this time you're going to bring your arm down to get a stretch on the top of your arm here. Now sometimes if tendons are quite irritated, a static stretch where you're holding it like this can actually kind of irritate that tendon further because you're kind of compressing it. So depending what works for you, if you're doing that and you're like, oh, that's quite sore, it doesn't seem to be helping, then we can do something kind of called a contract relax. So what that would look like is you would kind of have your arm and just where you feel a little bit of a stretch but you're not getting that pain. And then what you're going to think about doing is extending that wrist, but you're not actually going to be moving. So you're going to be pushing up into your hand with about maybe like 10 to 15% of your strength, pushing for 5 seconds, relaxing, and then going a little bit farther into the stretch. This just kind of creates a reflex for that muscle to relax instead of just holding it in that kind of compressed position.
That's good when my forearms are
Sore?
well, they're always sore. Actually, not treating for a while has loosened them up quite a bit.
Yeah, that's good.
So I've had these issues, both of these issues, and the surprise carpal tunnel as well. So
All right. And then if we looked at some kind of computer setup quick before we go into strength stuff, maybe if we just bring it around so you can see the keyboard. Okay. So if you're finding that you're having kind of that lateral elbow pain or that tennis elbow that we talked about, sometimes it can be due if you're sitting at your computer all day and you don't have a great setup. You can see that my wrists are kind of constantly in this extended position, which over time, if you're doing that for kind of 8 hours a day, having your wrists in this position, that can cause some irritation of that tendon up at the lateral epicondyle. So a simple fix can be simply just kind of rolling up a towel that you have at home and then placing your wrists over top of it. That just helps to put those wrists in more of a neutral position. So instead of spending all day with your wrists kind of extended, they're more in a neutral position. And it helps to alleviate some of the discomfort that you can be getting there, and also just prevent it from occurring so that you don't develop the lateral epicondylitis. And then we don't have a mouse on this computer, but same thing if you're working at home and you have a mouse, tend to have like your right hand if that's the one you're using all the time, and you're getting those symptoms in your right arm. Same thing, your wrist is in a little bit of that extended position. So what you can do is if you're kind of a little bit slow at work or you're not too busy, you can try switching that mouse over to your left side. So now this right arm's getting a little bit of a break and you're using your left hand more to offload that tendon a little bit to give it time to kind of relax and heal. So just some quick tips if you find that your home setup isn't really working for you compared to your office setup. All right, now some strength.
Strength, yeah. I can do some. So yeah, strengthening, again, this you want the pain to be managed. Like let's say if someone comes into the clinic and their mobility is restricted, then I obviously would treat them to get more mobile. I do more of the stretchings and then the stretching and then do some more strength. So the way I start it, like you do concentric, eccentric. So if we're doing wrist extension I'm gonna just cross my leg here. So if we're treating, and I do these for both, but if we're doing lateral epicondylitis, so kind of the pain on the outside of the elbow and forearm, I'll do wrist curls. Actually, I should do that. There we go. It's a very awkward position for me, but this is how you want to do it on the edge of the table, or you could do it on your lap, like down here, for instance. I'm just kind of raising it up a bit for you guys to see. So going up and down, up and down. So if that's too sore, you can come up and then use the other hand to bring it down to just do more of a purely concentric, so shortening exercise. That gets easy. Then you want to do eccentric exercise, so coming up and coming down slower than going up. So that's a bit more strenuous on the tendon and the muscle, so you get more strength increases with that. Or if again you wanted to just do purely eccentric, you can just push it up and then kind of come down like that. There's twist bars that you could use as well. We're not going to show that today just because not everyone has like those flex bars, and you know they can get expensive. You know, and Amazon's backed up, so you're not going to get those too quick. So those are some strength exercises you could do. It's very simple. And then I still throw in like radial deviation this way, for instance. And then if you have medial epicondylitis, same principle applies for that. If you even have like decurvins, for instance, I'll do more radial deviation and stuff. So yeah, doing those kind of strength exercises. Those are basic. Those help quite a bit. Any others that you'd like to show, Brooke? Or
I could show one. So another time that people kind of can get this is with kind of, we think about lots of the flexion and extension of the wrist that Sunny just showed, but often with that kind of rotation, so the pronation and supination. So if you're at home and you don't have like a dumbbell, you could always just grab like a soup can, even to do the one Sunny showed. But what you're going to be doing, same thing, arm would be supported on a table, and then from here you're just going to kind of slowly be rotating side to side. If you have a hammer, this actually works really well, so then you'd have the weight of the hammer kind of at the end here, and then from here you're just slow and control, coming down and back up. Same thing, shouldn't be aggravating your symptoms, but that could kind of start to work in a different plane of movement as opposed to just the flexion and extension.
that's a good one, yeah, because the supinators, pronators are involved in this.
Yeah.
One more for like a bit more challenge I can show. I'm gonna grab a kettlebell. Ooh. This one I'll show because the research does show your shoulder girdle gets weak too with this. Because you're changing the way you're using your arm. I'm gonna do it from the seated position, because if I stand up, you probably won't be able to see it clearly. Let's just raise this up to about here. So I'm gonna go way up here. I'm gonna lower my stool down so I look even smaller. So I like doing kettlebell carry. So if I'm going into more of, like let's say if we're looking at medial epicondylitis, I'll do straight overhead. So my shoulder's slightly extended, my head's pointing forward, and the bell will be on the outside, and you're going to try to keep it neutral. So if I come down, so the bell's on the outside of my head, and now you're resisting a little bit of, like you're actively flexing your wrist. The other way would be the bell coming on the inside, and now you're extending your wrist slightly. So you got wrist involved, you got elbow involved, and you got shoulder girdle involved. I like the kettlebell carries a lot, so that's a good one. Because right now, I already feel the outside of my forearm working. So I like to stay on fire, but not yet. So that's a good functional exercise. And you can think of things like that, right? So any exercise you do, you could bias certain muscles pretty easily. And it doesn't have to get fancy, like those extensions and flexions. That's going to help quite a bit, because it's going to translate into your day-to-day job. Like if you're a carpenter, for instance, and you have this issue, then well, yeah, you need some strength. Usually carpenters or people in trades don't notice this issue right away. It's like years and years of abuse that they do to their arms. So what happens with you age is it's not necessarily you get so much weaker, you just stop using things, and then that's what affects you. Like the percentage of how much you get weaker per decade or per 5 years after age 35 isn't enough to affect anything significantly. It's just, you just need to work on things. So that's some stuff to work on. Anything else to add, Brooke?
No, I think that's good. Like when we talked about kind of activity modification too, that doesn't mean kind of stopping the activity. It might, like I said, kind of Sunny said, if we stop doing the activity, that's not really going to help get better. It might temporarily get rid of symptoms, but you're going to likely have a recurrence. So making sure that you are still challenging that tendon and loading it so that it doesn't happen again in the future.
Mm-hmm. And this one's interesting because it happens to mostly not athletes.
Yeah.
Right? Pitchers can get it. There's some traumatic ones, but just like how it said, out of all the people with this issue, 4% are tennis players. So
I don't think on a placement I've ever seen an athlete that's had it. It's always been more just like desk or construction and stuff like that.
I've seen it once with like a pretty high level athlete, but it was badminton. which is still a racket sport, and there's a
Yeah.
lot of backhand and forehand, so she had a bit of both. That's not funny because she was
Not
great,
fun.
but she's good now. She was good way back then, and got back to competing. So, yeah, it could happen to. I mean, this one you got more for trades than anything. I've seen this tons for individuals in different types of trades, especially welders. I've seen, like, because they're gripping a gun. There was an interesting study that mentioned about tool usage and vibration that will increase your odds of getting this. So if you do work with your hands or tools, good to try some of these exercises out. So we showed all these exercises, very good as a preventative measure. So if you just feel like things are tight in your arm, just do these. Don't wait for the pain to start. That will save a lot of pain. And hello Danny. How are you, Danny? Sorry.
Most of the studies show that kind of looking after things earlier just helps, obviously, in the long term. If you wait too long, that's when it's going to be a little bit more problematic. Whereas if you kind of start early, then it's likely going to recover quickly.
Yeah, so stay on top of it, guys. Like, you can't stress it out. I know people might get annoyed of saying, like, just do your stuff. But I know it most, obviously, from treating patients, but then also treating myself. So if I don't stay on top of things, I pay for it. And I want to say at this stage, I don't want to do that. It makes me sound old. But if you stay on top of it, it's never an issue. So that's good. And these injuries get better on their own. Could take a long time, but you should know that, hey, if you have this, it shouldn't be like, okay, I might be stuck with this for life. Like carpal tunnel, for example, that can be a bit more aggressive. Some people get surgery for that. These issues, I think out of all the ones I've had, I think only 5 of them showed actual tearing on an ultrasound, which isn't common. So it's something that's easy to manage.
Yeah, and then like some of the research, people might wonder about like kind of like corticosteroid injections, or there's other kind of things, but same when I was looking at the research, there is an attempt to show that those are going to be more beneficial. They actually showed that corticosteroid injections might give like kind of temporary relief, but at the 6 and 12 month mark, those patients were kind of worse off as opposed to someone that just did like a exercise program. So definitely trying the exercise program first and giving it a solid effort before we jump to some of those more immediate pain relief strategies.
Very, very good.
Yeah.
I agree. This is good. If there's any questions, you may ask them. We'll give it a couple minutes. But yeah, I've seen this in various sports too, so it's something that's like, I don't want to say it's easy to treat, but it's easy to manage.
Mm-hmm.
This is the one where it's like makes you feel cool as a physio because you see fast progress when people, like you mentioned a good word, activity modification, and that's what it should be. It should never be like activity discontinuation. It should always be modify what you're doing slightly, and then you're back to it without any issues.
Yeah.
And those words that we learned in physio school, I forget what it was, like activity modification and limitation. Like there was those words that we used through like a theoretical framework. And I was like, oh, these are silly, or participation. I'm like, this is dumb. And then now I use it all the time. Same with like the ethics. I was mentioning this to somebody earlier, like ethics that we did in physio school. I was like, oh man, this is like, we just kind of not made fun of it, but we joked around. And now it's like the single most important thing to me. So
yeah, and some of the research classes with evidence, I was like, oh, I don't really care about
like
p-values, and then I'm like, okay, let me pull those up because I'm not sure if this is a good study.
Yeah, now we can appraise studies. Now I'm like researching more than I've ever researched. I should have started my PhD too. Good job, Brandon. But yeah, like you can appraise research and stuff like that. So yeah, important skills, but like it's just always try not to discontinue your activity. Try to find ways to adapt or to change it a bit, and then you're better off for it. Complete rest is not going to be good.
No.
We got some thumbs up. Shahad put thumbs up. A good friend in Toronto.
Nice.
But yeah, we ask each other daily questions and just random questions. It's pretty fun to do. We have a small little group and share pictures, and it's quite adorable. Thanks, Shahad, for setting that up. Yeah, if there's no questions, we're gonna end it. If there are any, just feel free. Like I know some of you message me on Instagram. feel free to message me. If you have any requests for the articles, I can send you any articles as well. Yeah, other than that, have a great weekend. Hopefully, don't enjoy the weather today because it doesn't look so good, but Sunday's going to be nice.
Yeah, it's supposed to be nice
20.
for the rest of the weekend, so.
Yeah. So we'll see you guys later.
Okay.
And welcome,
All
Brooke,
right.
again.
Thanks for everyone
Yeah.
for tuning in. We'll see you next week.
And